Welcome to the most no points in clinical setting. We will be discussing about breast mass. Suppose a patient comes to you with a complaint of breast mass, then what will be our approach? We need to differentiate whether the mass is benign or malignant. So we have divided this mass in 5 categories. First of all, suppose there is palpable mass, the first category, palpable mass, but the age of the patient is less than 30. Okay, then we will look for 2 to 3 cycle. In this case, we can observe this patient till 1 to 2 cycle. Observation can be done. And even after 2 to 3 cycle, if the mass is not resolving, we should go for USG. After USG, we should differentiate the mass. USG will show you whether the mass is of simple type or a complex type. Simple is usually cystic mass. अब अगर मास सिस्टिक है, so we can go for aspiration. Whereas if it is complex, we should go for biopsy. Okay, now the same case, the palpable mass, but the age is more than 40. Then we should not go for this observation period is escaped. Directly we should go for the USG, and after USG we should always go for look for whether USG or mammography can also be done. Mammography can be done. Along with this, we should always go for biopsy, it can be either by fine needle aspiration biopsy, FNAC, or it can be True-Cut biopsy, or it can be core needle biopsy. Okay, so we should not wait in case of elderly patient more than 30 years, as we could observe till 1 to 2 cycle in case of less than 30. Now we studied about 2 categories of mass. Now the third and fourth categories are again related to each other. Now if the patient comes with skin changes lesion, what could be the skin changes in case of breast disease? It can be either erythema, it can be PUD orange type of discoloration, or there can be scaling, or they can complain of nipple excoriation and eczema. Or eczema. So these were the skin changes complaint in case of breast disease. Now if the patient complains of skin changes and she is less than 30 years, then what we will do? And if she is more than 30 years, then what we should do? Look, now if the patient is less than 30 years, consider it as mastoiditis and treat it with antibiotic. And keep her in close observation for 2 weeks. Okay, after 2 weeks of antibiotic, again observe the observe the observe about these findings, whether she is improving with your antibiotic or not. If she is not improving, then you should go for the protocol according to the is more than 30 years. Now, if the patient is more than 30 years and she complains with erythema, pseudo-orange, scaling, excoriation of the nipple or eczema, then we should not look for mastoiditis. Means it can be mastoiditis, but our according to our protocol, we should perform bilateral mammography. Okay, if she is more than 30 years, always go for bilateral mammography. If it is normal, then go for skin biopsy. And we should also obtain, we can also obtain needle biopsy, skin biopsy or needle biopsy. Fine needle aspiration or any other type of core needle biopsy can also be done. What is the difference? A patient complains of skin changes, she is less than 30. Most common diagnosis will be mastoiditis. A patient complains of skin changes in the breast and the age is more than 30 years. Oh, it can be mastoiditis, but we should always perform bilateral mammography, and if the mammography is normal, then go for skin biopsy or needle biopsy. Now the fifth condition, and a very usual presentation in case of the clinical setting, will be nipple discharge. Nipple discharge, very common discharge is from the bilateral milky discharge. If the patient complains of, it can be bilateral milky discharge. If it is bilateral milky discharge, then always look for UPT, urine pregnancy test. If it is negative, suppose that the urine pregnancy test is negative, then go for endocrine investigation. Look for endocrine LHFSH. If there is any hormonal imbalance, prolactinemia can be there. Endocrine abnormality, very common cause is hyperprolactinemia in case of micro adenoma in the pituitary gland. Now the other type of discharge can be persistent spontaneous unilateral discharge. It can be persistent unilateral or bloody or serous type, bloody or serous. In these cases, we should always go for cytology. FNAC should be done, optimal choose mammography, and surgical referral can be done. Means biopsy is must in these cases. So what we will learn? We learned that if the patient is comes with palpable mass in the breast, we will look for her age. Whether she is less than 30, we will consider observation for 1 to 2 cycle. If she is not recovering, ultrasound. Then if her age is more than 30, we should not wait, or no observation period is considered. Directly we will go for USC and mammography. If the patient complains of the skin changes, then again less than 30, acute mastoiditis can be mastitis. Actually this is mastitis, sorry for the mistake. This is mastitis. Okay, and if she is more than 30 years, we should consider mammography, and if mammography is normal, we will go for the skin biopsy. And if the case is of nipple discharge, it can be milky discharge, we should look for the urine pregnancy test. And if it is unilateral persistent discharge, then we should always go for the mammography. Thank you.